I want to share a quick story with you about a 22-year-old female that recently came to see me in clinic. She came to see me in clinic a couple months ago with the chief complaint of rectal bleeding. When I saw her in clinic, she told me, "Dr. Glover, I've seen 2 prior gastroenterologists. I was pregnant, I just had my first child, and everyone is telling me my rectal bleeding is just hemorrhoids, which I know is normal and somewhat expected after pregnancy. But I know something is wrong. Can you please work up my rectal bleeding?" I said, "I agree with the prior diagnosis. It's probably hemorrhoids, but I hear you. If you say there's something is wrong, let's do a colonoscopy to make sure." So we eventually did a colonoscopy, and unfortunately there was a large rectal cancer. Everyone was shocked because she was only 22. I think this story emphasizes 2 important points. The first is that too often we as doctors, we've done more school than anyone should do, and sometimes that massive amount of education makes us ignore patient complaints. But as my years go by in clinical practice, I've come to realize and respect more and more, if a patient tells you there's something wrong, you believe them and you work up that clinical complaint to the best of your ability. Number 2, I think it emphasizes, and this is not the first time I've seen colorectal cancer in such a young patient, the rising incidence of colorectal cancer in young people. It's the leading cause of cancer death in people under 50 now, and I think the incidence has almost doubled in the last 20 years. So in this video, I want to share a couple stories and videos with you and provide commentary about the rising incidence of colorectal cancer, what could be causing it, and things you can do to help protect yourself. So that being said, let's get right into it.
Actor James Van Der Beek is raising awareness about colorectal cancer, especially in younger people, because it's now the leading cause of death for people under 50, and doctors say some of those cases could have been handled differently if people were screened at an earlier age.
It's so scary. I think this shook a lot of people. So our medical expert, Dr. Pat Coley, is with us this morning. Thanks for coming in.
Good morning. What a tragic loss.
Yeah, for sure.
It really is so young. So let's talk a little bit about James Van Der Beek. How old was he when he was diagnosed?
So sadly, he was one of those people under 50. He was only 46 years old when he was diagnosed in the summer of 2023. And as you said, leading cause of cancer death now in people under 50.
So an important point here is that we used to start screening for colon cancer at 55, then it was 50, and now it's 45. So make sure you get your colonoscopy at 45. The only time we screen before 45 is if there's symptoms or you have a family history. They said he was 46, so I don't know if he got his colonoscopy at 45 or not.
And if you look at James Van Der Beek, picture of health, was doing cold plunges, had no family history, didn't have any red flag symptoms like weight loss or change in appetite or anything like that. But when you talk to him, he does say in retrospect, maybe there were some subtle symptoms that he had missed or minimized.
So can we talk about that? Because he did mention that in
Yeah.
the interview, subtle symptoms. What would those be exactly?
Yeah, so in his particular case, he had a change in his bowel habits, and he attributed it to what he was eating. So he cut out coffee and he cut out cream. And the change in his bowel habits even then persisted, and that's what then eventually sought him to seek care. Now at 46, one could argue he should already have gotten a colonoscopy, because in 2021, they changed the screening age of colonoscopy down.
So what exactly do they mean by change in bowel habits? Let's define that more. By change in bowel habits, they're referring to a couple things. If you have diarrhea and it doesn't go away and it persists for a couple weeks or months, you need to get it checked out. The same applies for constipation. If you have a change in your stool caliber, meaning the caliber of your stool is getting pencil thin or changing or looks funky, you should get it checked out. Any kind of rectal bleeding, do not assume it's hemorrhoids. You need a colonoscopy. And to that point, your bowel habits should be considered a 5th or 6th vital sign. I know it sounds gross, but as a GI doctor, I'm telling you, you need to look at your stools every time. Is there blood? How does it look? What's the caliber? Look at your stools every day.
From 50 to 45. But then when he did get that colonoscopy, he had stage 3 cancer. But if you look at the medical literature, most people will have some symptoms at least 2 years before they get diagnosed. And so some of these symptoms, the 4 symptoms really to watch out for that are subtle: abdominal pain, rectal bleeding, and sometimes people say, oh, that must be a hemorrhoid, or it must be a little constipated, I must have torn something as I was passing stool. If you have iron deficiency anemia, or if you have intermittent diarrhea, if you have multiple ones of these symptoms, certainly go seek medical care.
Not just diarrhea, constipation as well.
immediately. But if you have something that doesn't get better, it's time to talk to a doctor.
It seems like this is becoming more and more common with younger people. Why is that?
I wish we knew the answer to that. We don't know, but we have seen a very sharp increase. Now, it's still a disease of people over 50, but we're seeing about 2 to 3%, and some estimates say even 10% of all new colon cancer cases are in people under 50. So we think it's a combination of many different factors, the biggest being what we're putting in our gut, the food that we're eating, processed foods, lack of fiber, alcohol, smoking, and then, of course, lifestyle factors like being sedentary and being obese. That seems to have caused an increase. We're also thinking environmental factors like pollution and exposure to microplastics may be part of what's driving this increase, along with the change in the gut microbiome, because we're using antibiotics a lot more and we're not eating as many pro and prebiotics as we used to before.
So you mentioned
It all goes back to the microbiome, right? These things are inseparable. The lifestyle factors, the things in the environment, all alters the microbiome. She says that we're not eating as many prebiotics as we should. What are prebiotics? Prebiotics is fiber, meaning fruits and vegetables. The number one determinant of your microbiome health is not just the amount of vegetables you eat on a weekly basis, but perhaps just as importantly, the variety of vegetables. The more different and amount of vegetables you eat on a week-to-week basis, the healthier your microbiome.
The recommended age for a colonoscopy is now 45. They lowered it just 5 years ago. It was 50, now 45. What about stool tests? Should we be doing those even earlier than 45? Do these even work?
Yeah, so stool tests I'm not a huge fan of, honestly. Now, they say you could either do a stool test every 3 years after 45 or have a colonoscopy every 10. Colonoscopy is the gold standard because you're looking for the disease itself. The stool test is going to miss precancerous polyps. In fact, they catch only 10 to 12% of them because in order for a stool test to be positive, you have to be bleeding because it's looking for blood. So I do not like people.
That's partially true. So what exactly is this stool test? You may have seen it on TV, the Cologuard test. It looks for two things, one of which is blood in your stool, whether you can see it or not. But there's also another component looking for the genetic material of large polyps and or colon cancer. The problem with these stool tests is that, like most things in life, if it sounds too good to be true, it probably is. Stool tests at baseline have a high false positive rate. About 50% of the time it will be false positive. But even more importantly, there's a significantly high false negative rate. The stool test is not going to detect these small polyps that if you leave them there, they eventually grow and turn into colon cancer. Not all polyps are cancerous, but all cancer starts as a polyp at one point in time, which is why we go in there with a colonoscopy and take them out.
Especially people that are higher risk to do just the stool test. I'm really a fan of the colonoscopy starting at 45. Now, if you have a family history, you may actually want to start earlier than 45. And that's not just a family history of actually colon cancer, but even a family history of having polyps earlier. So let's say your mom had a benign precancerous polyp at 40. You actually have to start screening in your 30s because of that family history. So I want every person to talk to their parents and figure out whether they've, because a lot of times people don't even talk about precancerous polyps. They just talk about cancer. Ask your parents if they've ever had any kind of precancerous polyp.
So a family history is not just, as she's saying, it's not just a history of colon cancer. There's a very real entity called colon cancer equivalent. So for example, say your loved one had a large polyp that was removed. Well, if it wasn't removed, it would have been cancer, right? So we consider that to be a colon cancer equivalent. It's not just a family history of colon cancer. It's a family history of any kind of polyps, particularly high-risk polyps.
Going back to James Vanderbeek, he was young. He had no history of it, right? He was healthy. Mm-hmm. Do you think that this will change the age that people will start to get screened?
I think it will. And it's interesting because when they changed it from 50 to 45, there was a ton of pushback saying we're over, screening and being too aggressive. And now that we're seeing even an increased trend, even in people in their early 40s, even sometimes in their 30s, I do think that the future holds perhaps even a lower age. Now, currently the inflection point for where the risk really increases is around 45. But I think it wouldn't be a bad idea like we do for prostate screening if we thought about pushing it down to 40. They have to.
I think it is going to go to 40 in the very near future. It used to be 55, then it was 50, now it's 45. We're seeing all these young celebrities. I see many patients with early onset colorectal cancer. I would be surprised if it was not moved from 45 to 40 in the near future.
Balance, of course, the risks of screening because a colonoscopy is an invasive procedure. What I'm hoping for is we start to get blood tests or we start to get some kind of a CT scan that can start to look for cancer without necessarily having to do a colonoscopy, because that's still something you have to prep for in an invasive procedure.
And pay for it. Can we talk about the out-of-pocket costs of a colonoscopy?
Ridiculous. So if you're one of those people who insurance doesn't cover it because you're less than 45 and you want to get it, it can be $4,000 or higher.
I probably shouldn't say this. The insurance companies are going to get mad. But if you want to get a colonoscopy before age 45, go to your doctor, tell them that you have rectal bleeding, tell them that you have a change in bowel habits. It will be covered.
$5,000, you have to pay for the gastroenterologist, you have to pay for the anesthesia. If you have a polyp, you have to pay for the pathologist, you have to pay for the hospital fee. So it's really out of reach, which drives me crazy because it's a cancer screening test. We really need to incentivize people to get this, not make it difficult and expensive so people shy away from it, especially if they don't have insurance. Who's going to pay for it?
Correct.
Is there anything that we can do to lower our risk?
That's the good news here. Even though we're seeing all this bad news, we're seeing good news is that you have control. So cutting out that alcohol, I know we've talked about it before. Less is more when it comes to alcohol. Making sure you're not eating cured meats, processed foods, the types of things that have been linked to colon cancer, adding fiber to your diet, and making sure you move 30 minutes a day. Those are really great ways that you can actually tangibly reduce your risk.
All very attainable.
Dr. Coley, lots of great information passed along. We appreciate it.
I want to share with you next this good article I found at the cancer.gov National Cancer Institute. As rates of some cancers increase in younger people, researchers search for answers. Maybe it was already there when he was at Disney World, sitting in his office on a late winter morning, wearing jeans and a hooded sweatshirt adorned on the front with a teddy bear in a business suit. Ryan O'Grady, PhD, said he couldn't rule out the possibility. I don't know, you can't really say if it was, but I think about it, said Dr. O'Grady, a mathematics professor at a small liberal arts college in Pittsburgh's northern suburbs. He's as educated as you can get. This is a mathematics PhD college professor who had symptoms of colon cancer. It was in February 2023 on that family trip with his wife and 2 young daughters when Dr. O'Grady first experienced some uncomfortable gastrointestinal issues. A generally healthy 43-year-old at the time, he saw no reason to worry. And why would he, right? We start screening at 45 now. It should be moved to 40. But as the year went on, the problems started occurring more regularly. Finally, with the holiday season approaching, his gastrointestinal difficulties became more frequent and more severe. With some spirited encouragement from his wife, Dr. O'Grady went to the emergency room. That led to a doctor's appointment and, thanks to an opportune cancellation, a quickly scheduled colonoscopy. Finally, 2 days after Christmas 2024, the call came from his doctor, colorectal cancer. Worst Christmas present ever. We were supposed to go to Columbus for a late Christmas with my brother and his family, said Dr. O'Grady. After some hesitation, they did go. To keep his mind from going down depressing rabbit holes, he spent a lot of time at his brother's house working. My wife was on the phone making all sorts of doctor's appointments for me. Several decades ago, aside from people with certain genetic predispositions, a diagnosis of colorectal cancer in somebody under age 50 was unusual, but that's no longer the case. Dr. Yu, MD, who specializes in treating colorectal cancer at the University of Texas MD Anderson Cancer Center, shout out MD Anderson, I did 3 years of my training there, said that when she was finishing her medical fellowship in 2009, the average age of people in the United States diagnosed with the disease was 72. Now it's 67, she said. And it's not just colorectal cancer that's being diagnosed more frequently in people under age 50. More than 10 other common cancers are also on the rise, including breast, uterine, and kidney. The increase has been most stark among people in the age range of 20 to 29. The trend has left many researchers perplexed and alarmed, and although there are some hints about why this may be happening, there are no definitive answers yet, said Dr. Yu, who directs MD Anderson's Young Onset Colorectal Cancer Program. I do not think there's going to be a single smoking gun, she continued. It's the million-dollar question everybody is asking, but it's a long horizon answer. A harbinger of a larger problem. The uptick in early onset cancer started to garner public attention in 2020 when actor Chadwick Boseman, the star of Black Panther film series and other hit movies, died from colorectal cancer at age 43. On the big screen, Boseman was handsome, muscled, and by all appearances the epitome of well-being. He was the last person many people expected to be diagnosed with, let alone die from, cancer. But relative youth is no longer the force field against colorectal cancer that it used to be. Early onset colorectal cancer is becoming the leading cause of cancer death among young adults in the United States, said Dr. Yin from Washington University in St. Louis. Dr. Cao is leading a first-of-its-kind research program investigating young onset colorectal cancer. One recent study, for example, found that nearly 10% of new onset colorectal cancers around the world are in people under the age of 50. In an additional study by the American Cancer Society, researchers revealed that early onset colorectal cancer rates have increased in 27 of the 50 countries included in their analysis. Additional cancers are also being diagnosed in older people as well. Recent studies have brought the scope of early onset cancer phenomenon into tighter focus. The results confirm that the trend extends beyond that of simply colorectal cancer. A NCI-led study published in May provided one of the most comprehensive analyses of trends in the United States. Looking at the data captured in two large databases, they found that rates of 14 cancer types increased in at least one age group among people under 50 between 2010 and 2019. But rates of new diagnoses for 9 of these same cancers also increased in people over age 50 in at least one 10-year age group. These findings make clear, Dr. Shields said, future research can't ignore what's happening in older people. We can learn something by looking across all age groups. What is behind the rise in early onset cancers? There's little certainty about what's driving early onset cancer trend, but multiple studies have pointed to the same potential culprits. More than a few studies have singled out obesity and heavy consumption of alcohol as likely key contributors. That being said, I don't understand because you see all these studies about Gen Z and millennials, the rate of alcohol use is decreasing markedly. So in my opinion, we can't just blame it on alcohol use because by all metrics, alcohol use in the younger generations is decreasing, but at the same time, colorectal cancer is increasing. So it seems like an easy cop-out if everyone just says alcohol when the data says otherwise. Others have suggested that environmental factors like an overabundance of microplastics in the bodies of younger people might be at play. Much of the available evidence puts the blame on another potential culprit, disruptions in the composition of bacteria in the gut and elsewhere in the body, known as the microbiome. One recent study also implicated bacteria, which is the same thing as the microbiome, but rather than a harmful mix of these organisms, it suggested that a DNA-damaging toxin produced by certain strains of E. coli may be a key driver. There are a lot of potential contributing causes, said Dr. Peters of the Fred Hutch Cancer Center during a session on early onset cancers at the annual meeting of the American Association of Cancer Research in April. But, Dr. Peters continued, for many of these factors, there's no strong epidemiological evidence that they're individually linked to early onset cancers. Like she was saying before, it's probably multifactorial. It's not just going to be one thing. Some researchers believe that with colorectal cancer and some other cancers, what is being seen is a so-called birth cohort effect. In the early case of colorectal cancer, as an example, for many decades, the disease was predominantly diagnosed in people in their 60s and 70s. However, starting with people born in the 1950s and becoming more pronounced for those born in the decades that followed, exposures to changing environmental, lifestyle, and other risk factors may have accelerated the time it takes for colorectal cancer to develop in individuals. In other words, Dr. Yu said, a whole package of common factors has created a new biologic window of opportunity for cancer to take hold in younger populations. Let's take a look at this TikTok video also showing potential causes of early onset colorectal cancer.
It's easy, but ultra-processed food might be a major health threat. A new study published Thursday in a major cancer journal looked at 30,000 women over 2 decades. It found a link between eating a high level of ultra-processed foods and developing colorectal polyps.
And these are the kinds of polyps that we believe are the main precursor lesion to the vast majority of early onset colorectal cancers.
The lead researcher says the finding offers a key clue to what's behind an alarming trend, the rise in young adults developing colorectal cancer.
We did expect that there might be some associations here, given that we are also seeing dramatic increases in our consumption of ultra-processed food.
It's a
Not the Cheez-Its, anything but the Cheez-Its.
big category of foods that are both highly processed and full of...
If you can't pronounce or know what the ingredients are, it's probably ultra processed and terrible for you. Don't eat the food if you can't tell what the ingredients are. Potassium sorbide, asparaginase, citric acid. That doesn't sound like food to me.
preservatives, items like mass-produced bread, many breakfast cereals, or instant soup.
So ultra-processed food is sort of that ready-to-eat, ready-to-heat type food. They don't contain a lot of fiber.
Ready to eat, ready to heat.
They have sort of the bad types of fats in them.
Still, this new finding isn't clear cause and effect. More research is needed to see where ultra-processed foods fit alongside other well-known cancer risk factors, like obesity and a lack of physical activity. Doctors and dietitians say one thing is clear: avoid ultra-processed foods as much as you can, and when possible, choose whole, fresh foods instead. It's fat.
Let's take a look at the couple of the comments here. Is this Eddie Murphy? Nothing But Love says, we know. Ice for Life 97, buy whole foods. Yeah, like we can afford to. I disagree with that. Whole foods, vegetables, fruits are actually very cheap at the supermarket. You can buy 10 bananas for a couple dollars. You can buy several pounds of sweet potatoes for a couple dollars. I disagree that whole foods are expensive. Gene Phillip agrees, fruits and veggies are cheap. Bratty Daddy says fruits and veggies don't provide enough nutrition. Humans need meat. We're omnivores. Meat is not cheap. You don't have to eat meat to survive. You'll get plenty of protein if you so desire with legumes. I'm not a vegan, okay, but there's plenty of protein in things other than meat. There's a reason why Popeye, with all the muscles, right? He ate spinach all day. Spinach is loaded with protein, as are beans. You don't need meat. Chris says, so basically what everyone can afford right now, because when you try to eat healthy, it's super expensive and people can't get by. Disagree with that. Little Guy says, likely a lack of fiber. We aren't eating enough fiber. He's 100% right. Average American gets 5 to 10 grams of fiber a day. It's woefully deficient. Shoot for 20 to 30 grams of fiber a day minimum. It'll improve the quality of your bowel movements. It'll decrease the risk of your colorectal cancer chance. And it's going to nurture a healthy microbiome. A lack of fiber is the most common thing I see in clinic. The Just Be Show. People barely have time to eat nowadays due to lifestyle changes and inflation. That's why people reach for these options. Many people don't have time to even cook a healthy meal. I think this is a much stronger argument than saying that healthy foods are cheap. Yeah, they're cheap, but they do take some time to cook, so I agree with the Just Be Show. It has more to do with the time sink in eating healthy food rather than the price. So that's what I have for you guys today. If you or your loved one has been diagnosed with colorectal cancer, or you know of stories of young onset colorectal cancer, share in the comments below. Please like and subscribe for this video to help get the word out. I hope you found this useful. I appreciate the time that you took to watch this video, and if you have any questions, go ahead and ask below. Otherwise, that's all I had for you, and I will see you in the next one.